I agree. Well, we've kept our guest waiting. So, Chad, would you like to introduce our guest?
Yeah, and my dad always said I couldn't walk and chew gum, and so I'm going to tell you, I'm going to talk and you're going to chew gum. Can you bring our guest up while I go ahead and
I'm happy
introduce
to
him?
do this. But I
All
need
right,
my
I am really excited to introduce our guest, and it's not because of everything on his bio, which was pretty fantastic, but there's a lot of things I saw in his bio that were really interesting. But it's the last thing that I'm going to tell you that made me so excited to bring him on, okay? Our guest, Dr. Elliot Rand, graduated from Howard in 1987. He started a private practice in January of 1990 and currently has a staff of 40 employees and docs. He had always understood the concept of referring to specialists, and he saw the need quickly to create a space where everybody could be seen under one roof. I absolutely love that. And so in 1993, he started hiring specialists to work under his roof, and he has built a thriving practice. He's had an active oral surgery and ortho program for over 25 years, an active pediatric program for nearly 20 years, a prosthodontist for over 10 years, and he's served his community and beyond for nearly 35 years. One of the things that caught my eye in here is that he's attended and lectured for Dr. Glazer at Smiles in the Sun, Longboat Key, Florida. Dr. Horowitz did that last year, and Dr. Bell and I are doing that this year. Oh, he's an avid photographer of wildlife and underwater photography. What he's here for tonight is to talk about Pearl, what it's done for his practice. But he's traveled to a bunch of countries and everything, seen, 40 countries, 7 continents, bipolar plunges from the Arctic and Antarctica, polar bears, mountain gorillas, humpback whales. But this is what gets me the most, because it tells me that my son can thrive in this world.
But anyhow, I know you guys invited me to talk about AI, and predominantly I want to talk about that with, the implementation of Pearl and how and why Pearl, since coming into my practice early in 2023, has changed my practice dramatically, and also with the implementation of using dental intel. And, I don't care where or how you gain your metrics, but it's important for all dentists to really have a handle and know your metrics. And there's simply no other way to get around how are you doing as a business, how's your team performing, and where and how you can do better. So in that journey, when I was looking at AI and I was debating between Pearl and another company, Overjet, I was just trying to figure out which would serve my practice better.
Hey, Dr. Rand, let me just interrupt you really quickly to ask you one question. If you would just do this for our audience, for people who will be listening in the future on podcast, would you describe the technology that you're talking about when you talk about Pearl? Or Overjet or these types of companies?
Absolutely. So I started to look for a company that was looking at AI and using analogies to look at your x-rays, and now, to look at an x-ray, analyze the x-ray so that you can show a patient better how decay looks. Because when we as dentists pull up a digital film, it's gray. They're seeing gray, maybe a little hue of black, white. They can't tell an incipient caries. They can't tell caries. They can't tell. They have to trust your word for the situation, because there's probably 600 shades of gray, and we can only see maybe 60 to 90 shades of gray. So as Chad puts on his glasses, I'm the same way. I'm looking at x-rays and I may miss a lesion here and there. So the AI now will spot the incipient lesions, the carious lesions, radiolucencies, calculus, and we can talk about that stuff, open margins, and that is simply unreplaceable, because the value in that really tells us what and how we can serve the patient better. Because as a leader, your job as a leader is to bring value to your team so they can multiply value to others. That's the simple thing. So using that AI really helps in that technology. So when my hygienist will do an FMX or bite wings, and we pull up that AI with that x-ray in front of them, we can colorize that picture with Pearl. And we colorize the enamel, we colorize the dentin, and then the nerve. So when I tell patients, look, that cavity has now passed the concrete, the hardest part of our body, enamel. It's gone into the sand and it's digging away. And when you put that mouse over that carious lesion in Pearl, it shows you the percentage of that carious lesion that has infected the dentin. And then once it keeps marching on, you tell a patient, once it gets to that nerve room, they have problems, they're going to need a root canal. So more patients are not only believing you, but they're seeing how bad or what's involved with that tooth. So in the general dentistry world, it's huge. When we talk about perio, it helps measures, it will measure from every CEJ to the height of the bone, the depth of the pocket on the mesial and distal side of the tooth. So when it does that and it gives you 2.0 or greater from the CEJ to the bone, you're already starting to detect perio disease. And we all know about perio disease, right? Dementia, diabetes, hypertension, things like that. So when you want to dial that down to a patient, they can really understand how bad it is. And it marks it yellow, red, when things are really bad. Because imagine that insurance companies get thousands of requests daily with FMXs for SRP. They're not sitting there with a GP guy looking up at SRPs and an FMX all day long and yay and nay, yay and nay. That's all going through AI. Every major carrier is using AI to detect caries and periodontal disease. They all are. And the sooner we start using it, it helps us support our case so that when they reject it, we can appeal the situation to the patient, not just with clinical notes, but understanding the AI. The bigger question is what happens when AI is fighting AI, which AI wins? But in the meantime, we want to keep at least putting that out there so patients can understand that. So Pearl has been able to show my providers and hygienists ways to communicate patients as to why they need the dentistry. It's not about the how, because all day long you and I could sit there and prep a tooth with our eyes closed, right? And just do the thing. It's the how that they're not interested, but it's the why. Once they start understanding that, 40% of your tooth is filled there. 55% of your tooth is filled, and you've had that molar since you've been 6, and it's been filled since you were a teenager. Do the math. It can fracture next week. It can fracture anytime. But at least then you're trying to be preventative. So you're sending in your pre-D and you're doing your situation based on that information. And the patient agrees to that. And by agreeing to that, your patient treatment acceptance percentage, getting them scheduled, will start to change and grow. So for example, I ran some benchmark numbers because I wanted to see how we're doing year to date and how do we do in 2023. So in 2023, my practice, when I just came on with the AI Pearl in March of 2023, I finished the year at 37% on treatment acceptance. Do you guys know what the national average is?
It's higher than 37, isn't it?
73?
No, 35.
35.
Wow.
35. Actually, on this paper, it's currently now 35. Back in 2023, it was 39%. The top 10% of practices are doing 58%. So 35% of your patients are saying yes to treatment. So currently, we're at 44%. So we've grown 7-8% in a matter of a year. That's huge. And that reflects also in the PPV, production per visit, just for my GPs. We were at 460. We're now at 520 per visit. The average is 460. So we were right on the average last year, and the top 10% are doing 650. So it's a slow growth because it's, implementing those things and showing patients and teaching, but a picture's worth 1,000 words. That's how things start to grow in your practice. But one of the biggest things I'm super proud about in my practice is the perio percentage. And that measures in dental intel, your 4341s, your 4342s, Arrestin, things like that, 4910, that perio journey. And that sometimes seems to be the hardest thing to sometimes dial down to patients. I don't feel like I got gum disease. My gums don't hurt me. But when you start showing them x-rays and you start getting these approvals and you show them we need to treat now this affected area with antibiotics and root planning and scaling, in January of 2023, my practice was at 7% in perio, detecting perio in anybody over the age of 30. I'm now 14%, projected to go to 18% year end. It's massive. I mean, not only does it affect your bottom line as business people, but it also just shows how your team is becoming more of a facilitator in connecting patients. And that's what we talk about, momentum, moving the needle with the team.
Do you think it gives confidence to clinicians? I know as a provider, even I'll look at an x-ray, I'll look at another angle of an x-ray. Like you go back and forth going, do I really see what I think I see? And there's multiple factors. One, is it the first lesion on a patient who's never had a cavity before and you're about to have a really hard conversation? Is it just a weird presentation, not historically what you would expect? But then young providers or even hygienists, I would imagine too, do you see an improvement in their level of confidence? Like, is it somebody in the back of the room going, yes, you're right, you've got this, like you should be empowered to have the conversation?
Yeah, I love that question. I absolutely think it does, because I know personally, before AI came around, before I was really using digital, I was constantly maybe telling patients, let's watch the tooth, let's watch the tooth, right? Now it's language, let's treat. This is why we need to treat. And then you got to get out of that modality. Yeah, if it's incipient, I'll be fine with watching tooth all day long, floss. We can measure that incipient lesion. Now the AI, I'll tell you, it's not 100%, right? And you can mark that x-ray on Pearl and say, you know what, I'm not detecting that situation. And you could click off on different boxes and, the incipient caries or caries lesions. And that will just kind of flicker back and forth, and you can focus on that and show the contrast more and really look at it a little bit more. Because obviously as the clinician, we're going to make that decision ultimately. But I think it really opens our eyes to the possibility of missing areas and missing lesions. And that's really the key, because we're human. I've missed lesions, right? So, I would hate to miss a DO and a year later come back and that DO is almost like, going to be an RCT post and core and crown. I'm like, how am I going to talk my way out of this situation? Right? So, we go up in there and it's like, oh my God, what did my associates? So you really want to, the young associates, some of them are more proactive in understanding that. You work with them to teach them the why and how to connect with the patients. And some of them are still uncertain, and I think it helps them to get a little bit more certainty in that value of knowing, hey, let's treat this now. This needs to be treated. And, how can I get you on the schedule? How can we move forward in that situation?
Well, especially in fairness, like many private practices, the clinicians running from a surgical procedure to doing a hygiene check back into a surgical procedure and forced to clear their mind and also become two very different people. The surgical dentist is not the same as the diagnostic, touchy-feely, conversational, like all present, all knowing, all being diagnostician. And so when you're having to like flip a switch constantly between being that person and the other, I can definitely see where technology would help you sort of refocus back in and say, check step, agree, don't agree, whatever, moving on, creating a treatment plan, doing the touchy-feely stuff without having to spend so much intellectual time on the actual review of radiographs. Being able to have that support system is huge.
I totally agree with you. But what becomes even huger in that story is the hygienists now are doing more of that proactive work for you before you walk in the room. Because before the AI came around and they would look at a thing, they're like, oh, doc, can you check number 19? They're telling me because they're maybe seeing that DO there, right? But if they're bringing that A up and they're putting it on the other screen, they're blowing it all up and they're showing this, they've already set the patient up to saying, let me show you what we're using in the office. Look at the great technology that we're using to detect your cavities in your mouth. And this is showing a cavity. And I show you when I click on and off of it and the colors, this is what I'm going to show to the doctor. And that, that just facilitates the way for you to move forward in your treatment.
I think what you just said is so powerful because, one of the things that I've always stressed is I never want a patient to hear something only once in the experience, right? They should never hear about a problem only once during that patient experience. And so before we had this technology, the hygienists were intimidated because they're told through their career, well, I'm not allowed to diagnose. So all I can say is, well, I don't know. Let me ask the doctor about this. And there is absolutely nothing definitive about that to the patient. Then the doctor walks in and he looks at the x-ray. Yeah, I think that's a cavity. Okay. Well, they've heard that from one person. When the hygienist has AI backing them up and they can say, okay, I think we have a problem here. Oh, by the way, we have this new technology. This technology has confirmed, and this is from thousands and thousands and thousands of data points where it's learned to find these things. This agrees with it, but let's make sure. I mean, now it's just, let's have Dr. Rand come in and make sure that he agrees with this. Not let's ask Dr. Rand if he wants to make some money.
Yeah,
I just
exactly.
so different.
I think Dr. Rand, I love what you said as well, because we've been using Pearl in our practice for the past couple of years. And, you know, I love hearing the hygienist going through the radiographs with the patient and saying, this is something that I want Dr. Duplantis or Dr. Kirkham to take a look at. And so in our practice, we do it a little bit differently. The colors don't come on until I go in there. And that actually works a little bit better because it becomes an educational tool. But I think what happens more so than anything is that you have the chance to be this huge hero on both sides, in that they lay the groundwork for you. They've prepped the patient. The patient's looking at the x-rays going, oh my gosh, because you and I both know that on almost every set of radiographs, there's going to be pink that shows up on it. Every set of radiographs. And, you know, you get to be the hero and say, you know what? This is an incipient lesion because it hasn't gone through the enamel. And this is something that I'm going to elect not to treat right now, but it's something that we both need to be aware of. So I would say our education, our prevention has gone through the roof, you know, and I would also say that our treatment has increased as well. And it's the things that make you go, you know, and there's things that you get in there and you're like, oh my gosh, I would have never imagined that this was as blown up as it was based upon the unaltered, or the unread, I should say, not altered, nothing's altered, but on the uninterpreted radiograph. It's been a beautiful addition to our practice as well.
Yeah, I love it. And I love what you said. And I think that's great because, you know, I just recently started implementing and teaching my staff my hand journey. And this is great. You know, it goes back to dental intel, but it's a hand journey. Okay. The first thing that we were all looking at was looking at our diagnostic percentage code. You know, what are we diagnosing on a daily basis, whatever that may be, right? The next code is patient acceptance, right? They're saying, okay, doc, I understand. I see the pearl. I see the connectivity. I understand I got a problem, right? Your treatment acceptance is the third thing. Them getting scheduled at the front desk and saying, yes, Dr. Rand needs to fix this. When can I schedule? What works out best? Those are three things that we can measure on a daily basis, whether it's Intel or whatever the programs you may be using. But there's two other things on your hand that we don't see, but we can understand. The fourth thing is called care. So when we have diagnosis and patient says yes, and we get them scheduled and we treat, and care is up here, front desk, assistant, you, everything's great. We'll look at your thumb. Reputation, thumbs up, 5-star. I'm a 1,000 plus Google 4.7 practice, right? 5-star right here. But if you have all these wonderful things, your diagnosis, your patient says yes, treatment, schedule the patient, right? And the care was like somewhere down in here, or your care was great and they were checked out and like something went wrong at the front desk. And then that reputation of your thumb, which is the most flexible finger, goes like this. 1-star, thumbs down, right? Doctor was great, system was great, loved the feeling. Front desk rude. We've all like seen something like that, and we want to like shoot ourselves in the head and go, "What did you do? What happened?" Like, so it's so important that that piece of Pearl, everything fits together for a reason of how you make that journey, and it's all about that journey with you and the patients, and continue to build that journey. I do believe we can never make 100% of our patients right. Sometimes my worst patient could be your best patient and vice versa. And we could trade all day long. But, as long as we're still staying consistent, giving them that technology and understanding the how and the why, and using that pearl, you'll be able to succeed. And that's what it's about. My favorite word that I teach all my staff is how. How can I get you on the schedule? How will you be making that payment? It's not about would you like to make that payment. So it's, again, how do you understand the dentistry that I'm showing you today? Do you have any questions? And leaving that picture up there when you're talking, it just saturates their brain and it moves it forward. The same thing when I tell my staff, listen, when you're going to do a 4336, I think it is, or something for perioinflammation, take a picture of that schmutz. Put that up on the screen, and I don't care, go in the back and fake it like you're doing an instrument. But let that sit on that screen there for 5 minutes. When you come back, and you're going to see the patient say, is that my mouth? Oh, yeah, I just was looking at the artificial intelligence, also at your advanced gum disease. Oh, yeah, that's in your mouth. And, and you rock and roll and you start treating, arresting, whatever it may be. So there's no reason that people should hold back. And I'm sure that Pearl is coming down with more abilities for us to see a lot more stuff that's out there. But between the calculus, the open margins, the decay, it's an invaluable tool, and everybody should have that practice in their own practice.
Dr. Rand, you've lectured, we've all lectured. And I think that one of the pushbacks that we get is, I can't stand it when I hear this, because I know people that thrive in this environment, but I hear it all the time. My practice is entirely insurance driven. And I just sit there for a second, and, part of me says, well, the majority of ours are to a certain extent. It doesn't mean that you're HMO, DMO, PPO, OPP, whatever, it's just that you've got, we all have to abide by what the insurance says. But to those people who are truly just purely insurance driven practices, if someone says that to you and you're talking about Pearl AI, what is your response?
It's simple. How do you drive the bottom line? How do you drive your production per visit? How do you drive care to the patients? How do you make sure that, when you took that Hippocratic oath, that you're not missing decay, you're not missing iridiolucency, you're not missing an issue, you're not missing perio. And if you're not using something to help you co-diagnose and no one else is in the room, you're running around like a bandit all day, doing things in one room, hopping to another room. If you're not using another tool to kind of help you preemptively before you walk in that room, you're losing out. To make that monthly payment, whatever it may be, $300-400, it's nothing. We all can piss away money, $300-400 in a heartbeat. Believe me, it's no big deal. But when you can use something that can make you grow, internally, and for your patients to grow and to talk about that when they go to the diner and these people are together and like, hey, my dentist just sent me some pictures of my teeth with the artificial intelligence. You can email to patients like that. It speaks volumes. There's no reason to not have that. I don't care if you're I'm a PPO practice and fee-for-service combination, but it's irrelevant. And then not knowing that the insurance companies are using this in their upper hand over you, then why aren't you using it then? We all know it's a game out there, and we're just so small in the pie. The patients are like this, and the insurance companies are like this. And who's the ones that are getting squished? We always are the ones getting squished.
So I think that there's something that needs to be mentioned, and you alluded to this early. You actually used this word at one point, and I don't want this to be lost on our audience, and that is calibration. So when you have a practice the size of your practice, and there's a reason too that so many PPOs have invested in this technology. Let me tell you, if you're wondering whether you should invest as an individual private practice owner, if you're wondering whether it's smart to invest in technology, watch what the PPOs are doing, because they're not just pissing the money away. No. They're gonna buy stuff that gets return on their investment.
Absolutely.
So what they've learned is that this is a great way to calibrate a vast number of clinicians and say, hey, here's how we all need to be looking at this. It doesn't mean we're going to have 100% agreement on the final diagnosis, but it does bring everybody closer to being standardized. And I think that's important for a practice like yours. I think it's important for multiple location practices as well.
Absolutely, because those multiple locations or practices like mine, you get to dial down with individual providers, from the hygienists to the docs, and if you're not seeing numbers that you should be hopefully seeing, it's not a tool between Pearl and other intelligence that you're using just to go after the provider and say what's going on. It's kind of work with them as to explain to them how the why and how do we present to patients, because they may not have those tools. They went to dental school just like you and I. And believe me, I've run across dentists all the time that have worked for me, and they got great hands, but they got no brain and mouth to kind of like explain the treatment so that we get the patient in that care value of kind of running the whole situation. And that'll affect you in that whole situation, because if they can't recommend the dentistry and say, well, yeah, you got a DO on 19, the patient ain't gonna know what the heck you're talking about. And it doesn't matter to me if you're gonna do the most beautiful carved composite in the world. That's great. But what do I do with the rest of the schedule when I can't fill you because you don't understand how we help the patients in that care? So
I have one last question as we get close to closing. How have your patients received the technology? Are they skeptical of it? Are they embracing it? Is there a little bit of both? And how are clinicians navigating those conversations?
Authentically, I think my patients have been blown away by it completely. They just love seeing it and understanding what's going on now in their mouth a lot better than before. So there's been nothing but positive feedback from patients. My staff tells me that patients are loving that situation. It's on our website as well. So we demo it there. And there's like a little Pearl video that patients can watch. We have it in the waiting room as well. So there's definitely zero pushback in understanding that. And it really has just helped them understand their dentistry and their need for treating those kind of situations. So it's a beautiful thing. No pushback on that whatsoever, Jennifer.
Awesome.
Yeah. So I have as we close, because we're I don't want to keep everybody over. I could talk about this for hours. I think you and I are on the same page with AI. I have a selfish ask for